Hello, everyone. Welcome to week 7, where we're talking about counseling Arab Americans and Muslim Americans, where we read a couple of articles by our wonderful system-wide director, Dr. Manojay Danishpour. So I'll start with our first reading on working with Muslim families in marriage and family therapy. So Muslim families describes an incredibly diverse set of people. So you don't want to assume any sort of religious homogeneity, theology, ethnicity, or practice. Our stance is socioculturally attuned, non-pathologizing, and power conscious. So what I'll do throughout this presentation is integrate belief and practice diversity, migration and acculturation context, family structure, gender norms, and therapy room implications. And these are also for you to integrate into your practice as well. Right. So, in many communities, Muslim families are underserved and over-suspected. Dr. Danishpour highlights that mismatch between Western individualism and egalitarian ideals and clients' collectivistic role complementarity expectations can cause ruptures. So, our task as therapists is to tune therapy to their meaning system without colluding with harm. So maybe think about a time when your here it says clinical habit, or what I'm thinking about is just maybe an everyday inference, favored individual autonomy, and how you might reframe that to honor family duty while preserving safety. So you want to you want to ask clients about their lived practice. Some practical impacts of this is session timing during Ramadan, prayer breaks, comfort with touch, seating to avoid accidental cross-gender contact, food and beverage offerings. You want to ask permission before involving religious texts or clergy. So some sample language that you could use. Some clients find it helpful to integrate their religious values. Would you like that to be part of our work? And then if yes, then you ask them how. So you want to avoid collapsing Muslim and Arabic or assuming uniform practice. So there are acculturation gaps across generations that can drive intergenerational conflict, such as things like dress, dating, autonomy. You want to document language preferences and consider same gender interpreters. A transnational tie, things like remittances, caregiving decisions abroad, they all influence definitions and solutions. So there's deference to father or older brother. The mother is the relationship broker, or the mother may be the relationship broker. There's decision making that's framed as what preserves family harmony and honor. And then there's maybe a reluctance to disclose private matters, some strengths that you want to be looking for and identify with the family is reliable caregiving webs, rapid mobilization of kin support, clear rituals for hardship. And then you also want to watch for within family dissent and make room for multiple voices. You want to explore expectations. So, questions like, what does a respectful spouse do in your family? What are signs of love? You don't want to impose Western intimacy scripts. So, if divorce is considered, you want to map legal and religious procedures and practical risks. You want to include community standing and financial security, especially for women. And safety planning supersedes custom when risk is present. So, regardless of the cultural background of your client, safety planning is always going to be take precedent. So you want to name structural stressors explicitly. Don't locate the problem only inside the family. You want to use family problem solving around things like school dress codes, bullying, and dietary accommodations. For youth, you want to scaffold bicultural competence using a both and identity, a both and in order to build identity and validate religious coping as resilience. So, something that you might say here is some clients prefer a therapist of the same gender or to meet individually before joint sessions. What would help you feel most comfortable and respected? You want to avoid physical touch like handshakes unless they're invited. You want to explain boundaries to extended kin who may attend and provide rationale grounded in respect and clarity, not in authority. So you want to keep the client in control of theological content. We are facilitators, not religious authorities. So a sample prompt you could ask is, are there teachings or stories that guide how you handle hardship? How might we use those here? When you're collaborating with clergy, clarify confidentiality and scope and avoid dual role expectations. So Dr. Danishpour cautions against framing differences as deficit. Practice cultural humility and ethical courage. If you misgender, assume shared stereotypes, or overstep, name it and repair. You can say something like, I realize I assumed X. That was my mistake. How did that land for you? Here's how I propose we proceed. Assessment is collaboration and paced to trust. Use interpreters trained in confidentiality. Avoid children as interpreters. You want to screen for depression, PTSD, and IPV with validated tools when possible. You want to discuss how symptoms are understood, like spiritual, medical, social, any of those types of issues. You want to invite meeting and then expand choices. So, an example here, you could say, what would protecting the family's good name look like if your daughters also had more voice? With couples, you want to map provision, affection, companionship as multiple intimacy channels. Use structured dialogues to prevent dominating voices. Consider language as, let's try a 2-minute turn each. I'll help keep time so both of you are fully heard. If violence is present, shift to specialized services and safety planning. You want to document any culturally informed decisions. You can combine solution-focused tasks like what works already with explicit recognition of discrimination. Scripts for youth that you could use. How can you be a good Muslim and a successful teen in this school? Let's list strategies. So for parents, you might ask something like, what are non-negotiables rooted in your values and where is flexibility possible? Many couples appreciate private education about anatomy, desire, and halal sexual ethics within marriage. Offer readings or referrals to clinicians of preferred gender for specific sexual health work. You want to maintain a non-shaming tone. So you need to hold multiple truths and help your clients do the same. You want to honor values and expand possibilities. Address stereotypes transparently if they surface in you or in systems around the family. If clients cite religion for harmful behavior, seek alternative religiously acceptable options with them and or consult with trusted scholars with consent. You want to explain confidentiality early and often, clarify what will and won't be shared across subsystems. When collaborating with imams or community figures, define roles and avoid creating coercion. Document culturally congruent choices like seating, scheduling for prayer as clinically indicated adaptations. Pick the minimum effective dose that fits clients' worldview. Introduce interventions with culturally attuned metaphors. With culturally attuned metaphors like tranquility through small daily tasks. Ask clients if leader involvement would help. If yes, plan a joint meeting to align messages like imams who endorse respectful marital communication. Avoid positioning leaders as arbitrators in private disputes unless clients' consent and safety is assured. You want to tie goals to client language, like feeling heard by elders. Record adaptations, so same gender sessions, prayer breaks as clinically appropriate. Plan booster sessions around religious calendars, so post-Ramadan check-ins, for example. Last piece here in this chapter, in this article. So something you can do as a reflection here is list 3 assumptions you hold about healthy couples and identifying how they're cultural. You can maybe recall a micro rupture with a culturally different client, person, interaction, something like that. What did you repair? And what is one concrete behavior that you can change moving forward? I know these are very specific to working with clients. These will hopefully be important as you go into your clinical work. If you want, you can use the ANVIT, if you remember, the attune, name, value, intervene, envision, transform, to outline that culturally congruent next step in that concrete behavior that you change. Okay, moving to our second and final reading of the week. So here we're going to go through Dr. Danishpour's and Fathi's decade review of Muslim marriages in the Western world. So my aim here is to equip you with a concise map of literature and a clinically useful lens. All right. So the review highlights both the centrality of marriage in Muslim communities and the relative scarcity of culturally attuned clinical research. As MFTs, we work with whole systems. For many clients, religious and spiritual meanings are integral to commitment, decision-making, and coping. So the authors ran database searches using terms like Muslim, marriage, couple, marital as keywords and screened abstracts for fit. They ultimately analyzed 26 peer-reviewed studies and organized them into 6 clusters. So just a piece of information here, much of the literature is qualitative, which is rich for meaning, but thinner for generalizability. Multiple studies show that for many couples, religious beliefs and practices scaffold marital commitment, moral responsibility, and exclusivity. So here you could practically ask something like, how is faith enacted day to day? Which teachings are salient for decision-making, conflict resolution, and boundaries with extended family? So you can use systemic maps that include sacred alliances. Assess whether doctrine is a shared anchor or a wedge. When clients invite, coordinate with imams or chaplains, this can legitimize change efforts and reduce resistance. Courtship pathways are diversifying. Digital platforms, broader spouse criteria, and negotiation of religious difference. Clinical implications include premarital counseling for expectation setting, boundary work with families of origin, and addressing stigma clients may face in their communities. So with this, you want to invite explicit conversation about how partners define a Muslim home, holidays, children's religious education, and extended family involvement. Here you can use structured premarital tools and tailor language to clients' beliefs. You want to avoid conflating culture and religion. Many women locate empowerment within Islamic frameworks, clinically address shame, sexual health, safety, and agency. You want to understand local religious arbitration systems and when to advocate for clients' rights and protections. Measurement matters. Consider culturally validated instruments. If you use standard scales, interpret conservatively and supplement with qualitative assessment, things like genograms, sacred genograms, community mapping. Literature highlights tailoring mainstream models to clients' values. So, for example, using Quranic ethics to frame coping, linking differentiation with trust in God, aligning cognitive work with clients' moral language, build relationships with local Muslim leaders for consultation and referral. Remember some of the sampling caveats. Many studies draw from engaged community members. Still, these findings counter deficit narratives and point to a familiar familiar marital stressors plus unique contextual ones. You want to hold a both and stance. Honor faith as strength while naming harmful applications of power. Make the micro system visible in the therapy room. Things like immigration stress, Islamophobia, and community reputation concerns. Hold humility and curiosity. Ask permission before engaging religious content. When safety is at stake, follow your jurisdiction's laws and your code of ethics while minimizing community harm. So some templates for you to use, consider using a sacred genogram to map multi-generational religious narratives, migration, and critical incidents. So remember, we've talked about genograms quite a bit in this class. Essentially, you're taking a standard genogram, like a traditional genogram, and adding more information to it. You want to pair this with an acculturation map that contrasts partners' values and practices, then negotiate shared rhythms. This review calls for moving beyond description into intervention science and for widening who we study by gender, class, sect, and migration status. Some training priorities that you have here is creating clergy and having clergy clinician partnerships and measuring development. So a couple of reflection prompts for you. How will you ask about faith without assumptions? You can maybe draft an intake question here or two. Where might your own beliefs create blind spots? Here you can maybe name a goal that you would bring to supervision or a discussion point that you'd bring to supervision regarding that. Then list 2 premarital topics you'll always cover with interfaith couples. All right, so key takeaways here. We want to note that culturally responsive, spiritually attuned systemic practice is both ethical and effective. Revisit these slides when you're planning assessment and interventions.